Hello and welcome, everyone. Welcome. Thank you for joining today's presentation from the Health Connector, where we will share information about the Health Connector's open enrollment period. Our presentation is Navigating Open Enrollment for Plan Year 2025 at the Massachusetts Health Connector. We'll get started shortly, just as scheduled. I do see more folks joining us, so let me just give them a couple more seconds. All right. Hello, everyone, and welcome again. I'm Nuri from the Massachusetts Health Connector, and I'm joined by my colleagues Thalia and Melissa, who will be presenting today's information. Together, we are here today to share information about open enrollment for Plan Year 2025, whether you're considering changing health insurance plans for the upcoming year or enrolling in coverage for the very first time. We'd first like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, we do have some information to share with you about our presentation format. You'll notice that everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 30 minutes, then we'll have time for a question and answer period. If you would like to ask a question at any time during this webinar, please use the Q&A button at the bottom of your screen, and we will be monitoring your questions throughout. We ask that you please do not share any personal information or private health information when you ask your question, as others on the call are able to see what you write. Again, please do not share any personal or private health information. If you do happen to have a personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connector's Customer Service Center and instructions on how to find help from a local assister. We are recording today's webinar, and following the session, you'll receive an email with the presentation, so there's no need to take detailed notes. And with that being said, I'll hand it over to my colleagues to get us started.
Thank you, Nuri, and welcome everyone again. My name is Thalia, and I will be presenting today's information along with Melissa. Okay. In our presentation today, we'll go over what is the Health Connector, how to apply for health and dental insurance, Health Connector coverage in 2025, how to save on your monthly premiums, and how to get help applying for coverage if you need it. Okay. And just a quick overview of who the Health Connector is. We are the state's health insurance marketplace for individuals, families, and small businesses, and we provide access to affordable health insurance. For those who shop for coverage with the Health Connector are usually those who can't get insurance through their job, their spouse's job, or if you have a part-time job that does not provide health insurance to their employees. The focus of our presentation today will be health insurance for individuals and families, but we also provide dental insurance and insurance for small businesses with 50 or less employees. When shopping through the Health Connector, you can be assured that plans meet state and federal standards of coverage. When applying for insurance through the Health Connector, you'll choose from a variety of plans based on the area where you live. And because the Health Connector is the state's marketplace, we have benefits and programs that can help to reduce your monthly cost on your health insurance. We have advanced premium tax credits, which I'll go over in more detail later in the presentation. And we also have ConnectorCare plans that are unique to Massachusetts and is based on an individual's and family's income level. And those eligible for a ConnectorCare plan may now qualify for low or no cost health insurance. And I will also go over our ConnectorCare plans in more detail. So we are currently in what we called our closed enrollment period, which runs from January 24th to October 31st. What this means is that to enroll in a plan with the Health Connector, during this time period, you must have a qualifying life event that will open up a special enrollment period. But there's no need to worry because we are approaching our open enrollment season. We're here to let you know that our open enrollment season is happening from November 1st and runs all the way through January 23rd. And during open enrollment, new and existing members can apply for new coverage or renew their coverage through the Health Connector. And these plans that you select during this time period of open enrollment, will begin coverage for February 1st of 2025. So what needs to be done during this time and what are the deadlines? So you can apply for coverage on our website, mahealthconnector.org. This application is available in English, Spanish, and Portuguese if that is your preferred language. The Health Connector and Mass Health use a single application to determine which coverage you might be eligible for. You do not need to know if you are applying for Mass Health or the Health Connector, as the system will make that determination once you enter your personal information, your income, your household ties, all those things. If you've filled out an application with us before, please don't make a new account. Instead, contact customer service and they will help you access your account. So open enrollment might look a little different for existing members and new applicants. Existing Health Connector members should not create a new application. Instead, update your existing application with changes to your income, your household size, or any other life changes. Existing members also should have received a preliminary eligibility notice asking to confirm their information or, if needed, to make any updates. Newly applying members will create an account and complete the application and submit any document proofs that the Health Connector might request. So for both new and existing members, you will be asked to select a plan and pay your premium, if one is owed, by January 23rd for coverage that starts on February 1st, 2025. Again, this is for our open enrollment period. There are a few qualifications you must meet to get coverage through the Health Connector. You must live in Massachusetts. You must be a U.S. citizen or lawfully present in the U.S. You cannot have or be offered health insurance through your employer, and you cannot have public health coverage like Mass Health or Medicare. And when applying for coverage, you'll need the following information on hand: your social security number for everyone applying, immigration documents, and any income information, including copies of your pay stubs, net income for those who are self-employed, and monetary determination if you are receiving unemployment. And if you don't have all this information at the time of completing your application, that's all right. Just provide us with the information that you do have, and we will follow up regarding more information if we need it. Okay, so one of the questions that we often get is how or what should be reported as income on the application. On this slide, you'll see what sources should be included and those that should not be included. So I'll just leave it here for a second for people to review. This information is also available on our website if you would like to review it. Additionally, it's important to keep your income and application up to date to make sure that you get the right amount of help paying for your coverage and lower the risk of owing money to the IRS at the end of the year when you are filing your taxes. You can log in at any time and update your information, not just at the time of completing your application. So after submitting your application, we ask that you check your mail from the Health Connector and Mass Health to make sure that there is no additional information that is being requested from you. Any documents you owe can be submitted online through our website within a 90-day time frame, just to make sure that everything goes as planned and you get your coverage on that February 1st of 2025. And I'll say this again, please make sure to update your application if there are any changes to make sure that you and your family will get the right amount of help paying for your health and dental coverage. Okay, so let's talk about ConnectorCare coverage in 2025. So in 2024, the Health Connector expanded eligibility for ConnectorCare plans as part of a pilot program. The ConnectorCare program, which combines federal and state subsidies, will now provide lower premiums, copays, and no deductibles to more Massachusetts residents in 2024 and in 2025. And even if you aren't eligible for one of our ConnectorCare plans because your income exceeds the limits, you might be eligible for advanced premium tax credits. So whether you select a ConnectorCare plan or a plan with advanced premium tax credits, you can be assured that they will both meet state and federal standards and lower your premium bill. And as previously mentioned, whether you're eligible for the tax credits or ConnectorCare, you have the chance to save on your monthly premiums. So with the advanced premium tax credits, the IRS will send the credits directly to the insurance company, so you'll pay less each month, and you can always decide how much of those tax credits you choose to apply towards your monthly premium. So that's good for someone whose income fluctuates. With the ConnectorCare program, your monthly premiums are lowered using federal and state funds if you are eligible for one of our ConnectorCare plans. These plans have low monthly premiums, low out-of-pocket cost, and no deductibles. And when you qualify for the ConnectorCare program, you will be able to select a plan type, which is based on your income and family size. And this will determine how much you'll pay for your monthly premium. And we'll see these plan types in a couple of slides. Okay. So all insurance companies who participate in the Health Connector now offer plans in our ConnectorCare program, which just means that more health plan options are available for Massachusetts residents. And you can see here on this slide the carriers that are available with the Health Connector. Okay. So what does this mean for Massachusetts residents? So very generally speaking, that means that in 2024 and in 2025, individuals and families with higher incomes will now be eligible for these ConnectorCare plans. So for an individual person, that income limit has been increased to 75, about 75K for 2025, and a family of 4, the income has been increased to 156K for 2025. As previously mentioned, if you qualify for the ConnectorCare plan, you will need to select a plan type that is based on your income. The dollar amount you see on these charts here is the minimum amount an individual could be paying in these plan types. So for example, the lowest cost plan for a type 2A plan could be $0, while the lowest plan in a 3B could be $147. Okay. So I quickly want to go over some of the tools we have available on our website to help compare your options and save on plans. So these are some of the factors that should be considered when you are shopping for a health insurance plans. There are your premiums, which is the amount you will pay monthly for your health insurance. There are covered benefits, which are the services that the carriers agree to pay for when you enroll in your health plan. And depending on the service and the carrier, you might be responsible for paying a portion of that service. That portion that you are responsible for paying will be your out-of-pocket cost. And lastly is the network that someone chooses to enroll with, which includes your doctors, your specialists, and the hospitals. And this will vary depending on the carrier and also on the plan type that you select. So to help new and returning Health Connector members, we have a few great tools that will help you compare and select an insurance plan. And I won't spend too much on this slide because Melissa will be going over these in a couple minutes. So our most notable tools are our Get an Estimate tool and our Plan Comparison tool that are available to everyone outside of their individual applications, meaning that you don't have to sign into your actual account to have access to them. These tools allow you to see what plans are available in your area and give you an estimate of what your savings might be. The Plan Comparison tool helps you find providers and facilities covered by these specific plans. Now, the Plan Finder tool works very similar to the Get an Estimate tool and Plan Comparison tool, but it is more precise since it is based off the information that you have provided in your individual application once you log into your account. And so now I will pass it on to Melissa so that she can demonstrate some of these tools for you guys.
Thank you so much. All right, I am just going to share my screen if I can have one moment. Okay, so this is the fun part for me because you can see how much you're saving when you are trying to navigate through this process. So what I'm going to do now, so we are in the home page. So when you go into www.mahealthconnector.org, you will get this page here. So on this page, we have a lot of resources, but the first one that I want to show you is our Get an Estimate tool. I'm hovering right above that. And so you'll have two selections that you can make here. You can either go on individuals and families or businesses. So I'm going to select individuals and families. Okay. All right, so basically what this is just a brief overview. Instead of doing the application, you can kind of get an idea of how much exactly you would be saving before you do the application. So we just want you to answer a few questions. So the first one would be choose your coverage year. So we would choose 2024. And then here you want to enter your Massachusetts zip code. So I will enter an example here, a zip code. Then you want to enter what you think your household income will be for the year. So I'm just going to put an example here of 45,000. And I'm just going to say there's one person in the household, just to make it simple. And then I will put the age of the person. I'll just say 35. And then also here, you want to select if this person needs coverage, if this person is pregnant, or if this person is disabled or blind. And those questions are here because they can affect your eligibility. So for this example, I'm just going to say that this person needs coverage. So then click on go to results. And then this is just a quick reminder that this isn't an actual application for health coverage, and that's fine. So we want to continue. And then here we get the estimated eligibility. So based on what we had put as an example, this household may qualify for an advanced premium tax credit to help lower monthly health insurance premium cost. So your maximum tax credit amount is $161. So what that means is $161 is applied every month to help lower your monthly premium cost. So here it says you are eligible for silver plans with monthly premium as low as $212.22. So that would be what you would pay per month for your monthly premium. And then also it breaks it down. So this household member and potential eligibility. So this person is eligible for a ConnectorCare plan with advanced premium tax credit. And that's great. So then we want to preview plans for this person. So then it further breaks everything down for you. So the program that this person would be in is the 3C ConnectorCare plan. This person falls into the tax of 308.64 FPL, and the monthly APTC for tax household again is 161. So then we see a list of carriers. We have the plan names, we have the coverage level and the monthly premium, and also the APT savings. We have the Massachusetts state savings and what you would actually pay monthly. So for the first example, I'll just go over that really quick. So for example, the WellSense Health Plan, that's the standard silver plan. The coverage level is silver. So this monthly premium is at $373.22. If we enter the APTC savings of 161, we would actually be paying, so you would take the monthly premium, you would subtract the 161, and that would leave you with how much you would be paying per month. So that is huge savings. And then if you just keep scrolling down, you will see the rest of the examples here. So based off of your circumstances, you would pick which carrier would be the best one. And then you would be able to determine which plan would work best for you. So then from here, if this seems like a great idea and you feel comfortable, you can apply through this page by clicking on Apply Now. Or you can start over and you can play with the estimate. You can put different figures there and you would be able to see what eligibility would be based off of your circumstances. So now I'm going to go back to the home page, and I just want to point out a few more things that's very helpful. So let me just exit. Okay, so if you hover above the Help Center, you'll see that you have selections here that you can choose from. You can either select Contact Customer Service, you can find local help in your area, or you can go to our Resource Download Center. And so I am actually going to click on that and bring you to our Resource Download Center. And here we have another tool. It's called the Plan Finder tool. Now, this is super helpful because another important thing that you want to do is you want to make sure that you are choosing providers that are in network with the plan that you're selecting. So I'm just going to click on Use the Provider tool. So also, this is for individuals and families. So I want to go ahead and continue. So here we want to enter real briefly some information. We want to enter the zip code. Do you qualify for a ConnectorCare? We want to say yes. And then what ConnectorCare plan type do you qualify for? And we're just going to say plan type 3. And then we continue. And then here, so we want to enter the provider that we are being treated by. So as an example, I'm just going to enter this provider, Dr. Christina Mimikos. So I select that one and I continue. And then we want to enter the hospital that we go to, that we get our treatment at. We can just, this is just an example. We can enter Boston Medical Center and continue. And then if we're being prescribed prescription drugs, we can put that in as well. We want to make sure that is in network. I'm just going to use this as an example. And then we click on compare plans. So here, everything is broken down. We see the plans, we see your drug, your prescription drug, we see your provider name, and you see the facility. So for this one here, the Harvard Pilgrim Healthcare, this is the first example. We see that the prescription is not in network with this type of plan, but we see that the provider is in network because it's listed here. And then we also see that Boston Medical Center is in the network, and that is listed as well. So that breaks it down further as we go along. You'll see the different plan types, and then you can make a better decision on which plan would fit your needs. Sometimes, you know, if you don't see your provider in the network, but you see that the plan has benefits that you can use, you can also, you know, pick another provider or stick with your own provider and pick a plan that has that provider in the network. So that is a great tool to use. So I'm going to go back to our home page. And then I am just going to show one more thing, and then we can take questions. All right, so I'm going to hover above the Help Center. I'm going to go back to the Resource Download Center. And then we were just at the Plan Finder tool, but I just wanted to show some other things here that are definitely helpful in navigating through the whole process of trying to pick a plan. So if for the 2024 Consumer Guide to Subsidies, I'm just going to click on that. And then this is basically an overview of the federal poverty level guidelines and just showing you what you may qualify for and you won't be able to qualify. And it just shows you examples of what you wouldn't be able to be eligible for if you were in those categories. And then just basically gives you more of an overview of how everything works, more examples. And then if you need help, we have a resource here on how to get help. So I'm just going to go back to the top of the page here. Actually going to exit out here. And then for the plan shopping guides, I'm just going to show this real quick. Here is a great tool that you can use if you are confused. You can go here and pretty much get some more help, a glossary of terms, and it's just more resources to help you make the best decision possible. So I'm going to exit out of here. And I'm going to stop sharing my screen, and then we are available now for questions.
Oh, wait, hold on, Melissa. Just a couple more slides.
Oh, okay.
Sorry, sharing my screen again. Okay, so once you've used all these tools and you've done your research, I just want to remind everyone that enrollment is not complete until you make that first premium payment. So anyone looking to get coverage for February 1st of 2025 will need to make their first premium payment by January 23rd of 2025. If members receive a bill for premium they are not expecting, they will have up until January 23rd to make any changes to their application. And here you just have an example of what your monthly bill will look like. It'll break down your monthly premium, show the advanced premium tax credits you apply to your premium, and if you are eligible for a ConnectorCare plan, the state and federal funds that are being added. So you can make your monthly premium payments one of three ways: online through the payment center, by mail, or over the phone. So I know we shared a lot of information with you guys, a lot of resources. I also wanted to share ways for you to get help in person if you need it. If you need assistance with the application process, we have resources available free of cost to Massachusetts residents. You can receive help with your application through customer service or our community partner organizations. Customer service is the best way to reach us, and that number is 1-877-623-6765. And we also have community events happening where you might be able to find in-person help. And in addition to customer support, we also have certified application counselors or CACs and certified navigators who are available to provide application assistance in their community. Assisters are trained and certified to help you with every part of the application process. They can be found at community health centers and hospitals, and they speak the languages that are most spoken in the communities that they work in. And I can provide a link to that page where individuals can search up assisters close to them. And now we can take questions. Okay. first question, I was on the webinar last week. I'm assuming you're talking about the HCB webinar. And yes, I will be sending out that email sometime this week with the presentation link and the recording as well. If your employer provides health care, can I still join the Health Connector? How would I go about doing that? So if your employer provides health insurance, you wouldn't be eligible for the Health Connector. I think there is an exception to that, Melissa.
Yes, there actually is an exception. So if your employer offers health insurance, but it's an health insurance that's not affordable to you, you could definitely be eligible for the Health Connector. You would be able to put in the health insurance being offered, and there is a tool that you can use to see if you would be if that insurance is not affordable, and then you would move along and be able to apply for the Health Connector.
Would being laid off and not being able to afford the COBRA coverage qualify for a non-open enrollment period? The answer to that is yes, you would be able to have an open enrollment period and still apply for coverage with the Health Connector in 2024 if you are being laid off and also choose not to take COBRA coverage. Okay. I am already signed up through my husband's login. We are told that he had to be the primary as we filed jointly. Sorry, we're gonna take a different question. Can I sign up for a plan before November 1st? Yes, you are still able to provide to apply for coverage before November 1st if you need coverage for 2024. Okay. I have a disabled spouse that is on SSDI, and I was told that she could use Medicare as a result. Can I sign her up for Medicare coverage on the connector? The answer to that is no, you cannot apply for Medicare coverage on the connector. Melissa, do you know where they could do that?
Right. So unfortunately, you would not be able to apply for Medicare. They have their own separate guidelines. So what we could do is we can give you information. We have another program called the Shine that can help you navigate through that whole entire process. They might be eligible to supplement the Medicare with Mass Health, but it would depend on their circumstances. So we would definitely need for you to refer back to the Shine program for more information on that. But no, you wouldn't be eligible for the Health Connector.
Can I jump in here very quickly and go back, revisit the question with the individual who has a head of household who's turning 65, if you guys don't mind? I think that for this question, the person asking it'd be interesting to know how they've tried to remove the head of household. I think from my understanding, I don't want to overspeak here, but once there's a head of household assigned, it's a little bit difficult to remove that person. So curious to know how they have tried to do so and if they've tried to contact their customer service center. But not sure if Dalia or you and Melissa have any other recommendation for this individual to try to remove that head of household or make changes to the household in general.
Yes, I can actually speak on this one here. So when doing the application, you can edit, you can go in and make changes. So there is a section where you have to indicate whether or not that person is applying for health insurance. So you would indicate that no, that person is not applying, and you can remove that person that way. I think that because it's a complicated situation, we can have you can call the customer service number and have somebody help you navigate through that. But there is a way that you can remove the head of household so that you are the person on the application at that point.
And can you apply in person on site versus online? Yes. So if you need assistance applying, you can visit one of our CAC organizations or our navigator organizations, and they can help you complete the application in person. And you can work one-on-one with somebody that way. Okay. Please confirm that if you choose your 2025 plan by 12/23/2024, the coverage will begin on 1/25. So yes, you have to select and pay for a plan by January 23rd, 2025, in order for your new coverage to start on February 1st of 2025. Okay.
Talia, can I jump in here very
Yeah,
quickly?
go ahead.
I think this question, though, was addressing folks who wanted coverage for January 1. So those who want their coverage to start January 1st will need to select a plan and make a payment by December 23rd of 2024. Can you guys confirm that information?
Yes.
Thank you.
Looking through the questions. Sorry, everyone. And I think some of these questions were asking about also about coverage for 2024 as well as 2025. So I'll just clarify that now. If you are still looking to get coverage for 2024, there is still time to do so. So since, for example, we are at the 16th on the 16th today, if you wanted to get coverage for the first of next month for November 1st, you would have to select a plan and pay your premium for next month by the 23rd of this month. And that is the same for the remainder of this year. Because I do see a couple questions about that. And then what if you are in a divorce process and do not know the alimony amount yet and your income is low? Melissa?
Oh, yeah, sure. So usually what I tell members is, just put the best amount, the present day amount, if you don't have that information yet, just put the information you do have. And at the end, the application will indicate if we need more information, if we need income verification. And then at that point, you have 90 days to submit that information. But you also have the opportunity to go back into the application and update. So, for example, um, you have information, but you don't have the complete information, you can always go back and make changes as you go.
Can you do the comparison of plans before open enrollment period?
You want me?
Yes, please.
Okay. Yes. Yes. So you can definitely do a plan comparison. So open enrollment starts November 1st. But even if, before then, you want to make some plan comparisons, just like the tool that I use as a demonstration, you can go in, you can put in your information, and the system will give you a brief overview of what you may potentially be eligible for. So that would be a helpful tool. But yeah, you can definitely do your plan comparisons that way.
And people are asking about the webpage, and it only has rates for 2024 and not 2025 rates. I'm assuming that the rates for 2025 will go live on November 1st. And what if medication that one currently takes is not on the plan? I'm assuming that you can go on to one of these tools and find another plan that does cover that medication if you are willing to change your plan, just as long as you use the other tools to make sure that it's still covering your other providers. your other medications and any specialist that you see.
And just a real quick thing I want to mention here, that we have our tools which are super helpful, but there may be a chance that we may not have the most updated, or maybe you're having trouble finding something in the tool. So as an extra way to check, I would just refer back to the plan. You can give them a call and you can ask them directly, like, I have a prescription. I'm not sure if it's in network. Can you please verify that? And that's just an extra step to be sure that, you're also selecting the best plan, and you get the most information when you're making that decision.
Do we shop for dental in a different way?
I can, did you want me?
Yeah, go ahead.
Okay. So dental is separate from the medical. So when you're in the application and you are shopping, the system's going to guide you through. So you will pick your medical plan first, and then you'll have your option to pick dental, as dental is separate. Dental works a little bit differently than our medical. I usually tell members it would be based on if you expect to have, a lot of dental work done for the year, you would pick a plan that would, provide more of those benefits. And then you can make your selection. And then at the end, you do your enrollment. So you can enroll both in the medical and the dental. Another point I wanted to make is that you don't necessarily have to pick the dental with your medical. You can actually enroll in dental at any time. So if you just wanted to pick your medical and you weren't decided with the dental, you can add that at any point in time.
And since we are on the topic of what dental and vision, our do plans provide vision?
So I can also answer that, because actually that's been a question that's been asked a lot lately. And I've been exploring that with members. So some plans actually would cover you getting an eye exam, or sometimes even surgery. It would depend on the plan. So what I've been doing is I've been helping our members by just calling the plan to see, exactly what is covered, if it's covered. But typically, no, vision is not a covered benefit. But we do tend to double check and see, because some plans sometimes they will cover, you know, eye exam, or, you know, something with surgery related to the eye. So that's something that we tend to double check.
I'm just scrolling through the questions here. Um, I don't want to risk any cancellations due to a missed monthly payment. Can I just pay the entire annual premium upfront? Melissa, do you know?
I've never had someone want to pay the whole annual. Um, I don't think our system would actually allow for that. So what I would recommend you do is, we do have an auto pay option, and you can just enroll in auto pay and have it deducted from your bank account every month. You can select from the 15th or the 23rd, and it would do it that way. Um, Besides that, I don't think that we can force the system to take the whole annual payment.
Hi, I recently applied for the Health Connector and it says my decision is pending after asking for proof of income, which I submitted. Do you know how I'd find out my eligibility and how long it would take?
So I actually have this question come up quite often, and it sometimes can be confusing. So after you finish your application, you will get a determination on if you're eligible and which program you're eligible for. So it'll basically say if you qualify, it will be like a connector care, and it would state if it's a connector care plan 2 or 3 and the type of plan. So then when you see that in a blue box, you check off that you want to select the plan for the year. So then you will go in and select your plan based off of that information. Sometimes I know that because that part is confusing, it may seem like that's the end, but you have to go in and do the actual selection of a plan if you are eligible, and it shows you your eligibility.
I just moved to Massachusetts and I'm looking for a job. Will I be able to apply for coverage? I believe the answer to that is yes. You can still apply for coverage even if you don't have a job yet. You just would have to provide proof of residency, and they would ask you for that when you are completing your application. So yes, you can still apply for coverage with the Health Connector. Um, which income tax year is used for 2025 health coverage? What number of the income tax return is used to measure income?
So we go by the present day tax, so we would do the 2024.
Okay. If I've used a navigator when first enrolling in 2023, should I continue to use their services for open enrollment? Thank you. So if you have used a navigator in the past, they can continue to help you, but if you feel confident in that you're able to complete the application on your own, you can also do that. Um, I think that there are some instances where if you work with the navigator, you need to call customer service and get your login information to be able to log into the system on your own. Melissa, can you confirm that?
Everyone should actually have their login. So yeah, if for any reason you don't have your personal login information, there are ways that you can go in and reset it. You would just need your email address and your password. But yeah, even so, if you're working with an assister, they can definitely help you if you feel more comfortable doing it that way. But you can also go in on your own. You can log in and you can, however you feel comfortable, you can, make changes based off of your login information.
Okay. And did I hear correctly that if you currently have a plan through the connector, you should not create a new eligibility application for 2025? So if you are a current Health Connector member, you should go in and update your application. Melissa, can you confirm they can still do their application for 2025? Just that information from 2024 will be pulled into your application for 2025.
Yes, exactly. So, you can go into your application, yeah, and there's like a section there, where all that information pulls into 2025, just like you said. It would copy everything if there are no changes for 2025. So you can choose that option, but definitely don't create another account. It will be very confusing. And I don't think the system would allow you to create another account, but you definitely don't want to duplicate accounts. So you can just go into your current account and make changes based off of the year. Just select the year, and you should be all set once you do that.
My husband is self-employed. Would it be better to apply for family health insurance or as an employer? He is the only employee. So if your husband is self-employed and he is the only employee, I think they're asking about if they would be able to get insurance through the Health Connector for Business side. So if he is the only employee, you would still have to come over to the individual and family side and apply for coverage that way. Um, Sorry, I'm going through, there are a lot of questions. Just trying to hit the most.
Let me know if you need help with all the questions. There's so many.
Um, if you're an individual and applying for yourself, are you also then the head of household?
Yes.
Um, Are the Delta dental plans offered on the connector less expensive than those offered directly through Delta? I personally cannot speak on the prices, but I know that when you apply through the Health Connector, you are not eligible for subsidies that could help to lower those costs. Melissa, did you want to add anything to that?
Yes, so that is a perfect answer. And also just want to mention that um, the the dental is different. So we have plans that are basic, and then we have plans that offer more benefits. You would pick something based off of what you intend on doing for the year. So a very basic plan can be as affordable as $11.82. But if you know that you are going to have extensive dental work done for the year, and you're planning on doing that, you will pick something based off of that. So you can get something for $30 that would be some added benefits. And you would be able to manage it that way. So it's based off of what you plan to do for the year. If you know that all you need are your two cleanings, you could pick something that's basic and as affordable as $11.
I see someone here that said the Health Connector put me in a standard plan with a premium I cannot afford. I don't understand why. Please help. So if you feel that you are unable to pay that premium, maybe there was something that you reported in your application that wasn't accurate. And I would say maybe go back in, make any updates to your income, your household size, those type of things. And if you are still getting a plan that you can afford, maybe try working with a navigator and or a CAC that could help explain these options to you and why that plan is being offered to you. Melissa, would you like to add anything else on that?
Yes, definitely follow up with us and definitely take a look at the application because a lot of times members say, all of a sudden my premiums are super high. What's going on? And it could be because the system's triggering that we need some kind of documentation verification. And because we haven't received that, it's probably prompting the system to increase your premium cost because we need more information from you. So definitely connect with us or get help to see if everything is up to date. And because that's the only way that we can determine whether or not you're in the best type of plan and eligibility.
Okay. Can the premium be paid bi-monthly, split between the 15th and the 23rd? The answer to that is no, the premium cannot be paid in that way. You do have to pay the full premium amount on the 23rd of each month. Our current plan ends May 31st, 2025. Can I apply during open enrollment but not start coverage until June 1st, 2025? So you can't apply during open enrollment season, but if you do lose coverage after May 31st, you can then come onto the Health Connector and that will open up a special enrollment period for you because you are losing your coverage, and then you would be able to apply with us.
Can I just add to that,
Yeah,
please.
go ahead. Go ahead.
That was perfect answer. I just wanted to say that if you're losing coverage for May, you want to make sure to apply by April 23rd. That way, there's no gaps in between.
And if you have changes in income, can updates be made anytime to revisit the premium cost? The answer to that is yes. Anytime there are significant changes to your income or your family size, anything of that regard, you can go into your application at any time and make updates so that your premium cost can be revised and your plan type can be revised. Okay. Nuri and Melissa, if you see any questions in these last couple minutes that we should make sure to hit on, let me know.
Thanks, Talia. I think it'd be great if in the last couple minutes I am still seeing some folks asking about coverage prior to February 1, 2025. So if either of you could just reiterate, for folks what they need to do if they do want to have coverage, let's say for December 1st or January 1st, what they would need to do. I think that'd be great just because I do see some questions still about that and some confusion around that.
Okay, so if you need coverage before 2025, if you would like your coverage to start on January 1st, you would need to select a plan and pay your premium by December 23rd of 2024. And that is the same for the remainder of this month. Any month that you would like coverage to start, let's say if you would like coverage to start November 1st, you would need to make a plan selection and pay your premium by the 23rd of this month. And the same thing for November. So November 23rd, you make your premium and you would have coverage for December 1st. I hope that's clear enough.
But then just to clarify, open enrollment doesn't start until November 1st.
Exactly.
It can be confusing. And then for folks who do sign up for coverage still in 2024, can you just remind them what they would need to do going into 2025, the new calendar year, if they need to do anything at all?
For existing members.
So for an example, if I go in on November 1st and enroll in coverage, right, for December 1st, or let's say November 23rd, I selected my plan, I made my payment, I have active coverage for December 1 of 2024. In January of 2025, do I need to do anything differently?
So I would say no, because unless there have been any changes to your income, you would not have to make any changes because you updated your application so recently. So that information from December would pull over into your application for the new year for January. So unless something has changed, you should be all set. If by then you want to make changes to your plan, then you can do so. You still have time to do so until January 23rd.
And if I can also add, when you're doing the application for 2024 and you finish that application, you're going to get a question asking you if this also pertains to 2025 because we are approaching that date. So once you see that question being asked on the application, just click and it will copy over to 2025.
And I think,
Oh.
oh, go ahead, Nuri. I'm sorry.
No, I just said thank you. I'm not sure if you guys want to take one last question in the last minute that we have, or
Yep. I
happy
think
to
we could
wrap
take
up.
one more question. Can I cancel the health care coverage from Health Connector if my employment status changes? So yes, you can essentially cancel your Health Connector payment at any time if you have a job that now provides health insurance. All right.
All right. I do want to reiterate that the presentation recording and slides will be sent out because we do have some folks asking of where they can find these tools that Melissa shared with us today.
Okay. So I did see a couple people say that they have not received the recording of the webinar. And I want to share that our YouTube page has all of these recordings it'll have the one from today, and it also has information from past presentations if you are looking to rewatch any of those in the meantime before this one is sent out. But it is the same information, so you can access that on our YouTube page. But this will be sent out as well via email.
All right. Thank you, Thalia. Thank you, Melissa. We do want to thank you all for joining our webinar today. We had a great crowd, lots of great questions. So from everyone at the Health Connector and all of our sisters, we do wish you all well. Thank you and enjoy the rest of your day.